Welcome to Shape of the City, where we cover health and wellness topics relevant to the Lincoln community. I'm Clover Frederick, and I'm your host. Recently, the Partnership for Healthy Lincoln received a $2 million, 3-year competitive grant from the Centers for Disease Control for health initiatives related to Lincoln and Lancaster County. Today, I'm joined by Dr. Bob Rauner with Partnership for Healthy Lincoln and David Humm from the Lincoln-Lancaster County Health Department. Hello, thank you for joining us.
Thanks for having us.
Sure. Well, let's get started. Dr. Bob, will you tell us a little bit about this grant?
Yeah. Well, first of all, it's a grant that had to be a partnership of multiple groups. It had to be involving multiple sectors, and there's actually 13 other groups that are part of this grant with us. That was actually one of the requirements for the grant. The CDC was a nationwide grant. 39 were awarded. A couple things that it had to have. One is you had to have some existing efforts that were already in place, and this group of folks has been working together for several years now. And that's one of the reasons we were able to get the grant. We also had to demonstrate that we've done something kind of like this successful previously, and we have in Lincoln Public Schools. And so part of what we're doing is actually expanding the efforts in Lincoln Public Schools that have been working for the last couple of years. Okay.
Well, you mentioned we. Tell us a little bit more about Partnership for Healthy Lincoln.
Okay. Well, we were formed about 4 or 5 years ago. Basically, it was a grant mostly funded by Community Health Endowment, also St. Elizabeth's and the County Medical Society. Basically to bring folks together to reverse obesity and improve fitness. Started mostly with kids in the school system. That was our biggest partnering project we started off with. So Lincoln Public Schools and a couple other groups like Teach a Kid to Fish have been working together with Lincoln Public Schools on their projects for the last 4 or 5 years. Part of the grant, we had to show that we've been successful, and actually Lincoln Public Schools the last 4 years has lowered obesity and improved fitness year after year. And so that was one of the things that made us qualified to apply for the grant, is that we've shown that we can show that we could do it once, we could probably do it again. And so what we're going to do is broaden the efforts. Instead of just the schools, it's going to be before the schools, so kids in the preschool and infant age group. So MilkWorks and Community Action Partnership and Teach a Kid to Fish are going to take on that chunk of the grant. In the school age kids, we're going to do things around the schools. So the community learning centers are involved. A lot of the agencies that work with the schools and the after-school programs like the YMCA, Parks and Rec, Malone Center, groups like that will be part of it. And then also neighborhood organizations. So people that work with either ethnicities like El Centro de las Americas or Malone Center, or people that work in the community like Community Crops, for example, will be part of it.
Okay. Tell us why these efforts are so important in our community.
Okay. Well, part of the problem is obesity and fitness is now becoming the #1 cause of preventable death. We've made a lot of success in smoking. Smoking's down from about 50% of the population 30, 40 years ago to less than 20% now. So a lot of good success. So as that's gone down, unfortunately, obesity and fitness have gotten worse, and so that's actually become the major cause of preventable death long term. And so we want to work on efforts that will make a difference in that. The biggest thing is you have to move beyond just education to actually changing how things are done to actually make a big impact. And so in Lincoln Public Schools, they don't just educate kids about what's healthy to eat and being active, they actually change things. So reinstituting a policy for all schools will have recess, limiting some of the junk food fundraisers, improving the lunch program. So you need to know more than just educate, you actually have to change things, and that's what made a difference.
Very good. Let's switch gears a little bit and talk to David. You're with the Lincoln-Lancaster County Health Department. Tell us a little bit about the city agencies that are involved in this grant.
Sure. Well, it's great to have a supportive mayor for a healthy community, and so he does encourage all of the city departments, of course, to be part of that. And actually, with part of the outcome-based budgeting, we have healthy and productive people as one of the indicators. So all city departments, think about this issue in their programming. We have many of the obvious things, of course, the health department, city parks and rec, 10 Health, our very own 10 Health here, of course. So those are the obvious players, but again, all the city departments are part of that. As far as the health department, we try to work with all of the departments and of course community partners, and we're part of Partnership for Healthy Lincoln also. Probably one of the biggest citywide efforts anyway that people may see is 5, 4, 3, 2, 1, go, kind of the countdown message anyway. And again, it's a citywide message. It's a message, not a program. It's just encouraging people to take steps every day. to be healthier, focusing on children and families. A lot of the youth-serving and family-serving organizations have adopted that message, and we're kind of a technical assistance in implementing that program, or that message anyway, so they can reach more kids and families. As part of that, we have been nationally recognized for the efforts regarding that. Another kind of key part of that is Let's Move Lincoln. The mayor in 2011 signed on to Let's Move Cities, Towns, and Counties, which is part of Michelle Obama's childhood obesity initiative. With that, there's kind of 5 different goal areas that you work towards, mostly focused on physical activity and nutrition. And actually, just recently, Lincoln was recognized. We're just one of 16 cities across the country that have reached gold in all 5 of those areas. There's about 450 or so cities that are part of that initiative, so that's pretty neat to be just one of 16 cities anyway. And then also as part of that, I think Lincoln is nationally recognized for its parks and trails and kind of the network that we have to get people moving. And here this past summer, Lincoln was just recognized as a Playful City USA. I think we were one of like 216 cities this year to be recognized as emphasizing play. And again, that was geared towards the programs we have available through Parks and Rec and the Health Department in promoting play as an important part of our community. So,
very good. Well, of course, we'll be doing updates here since it's a 3-year grant. We'll be doing updates here for the community, but what are maybe some of the first things we're going to see as part of this grant?
Well, part of it also, we talked about, the schools, the nonprofit sector. The city has 3 agencies, the Parks and Rec, Channel 10 Health, and the Health Department involved, but actually the grant had you to go to other sectors too, so the business sector is going to be involved. Workwell is one of the agencies that will be working with us. They do employee wellness because if you're going to reach the whole family, you get the kids at school, you get the parents at work. Mm-hmm. They also ask that you reach out to the faith-based sector. So we actually have Salvation Army as one of our first groups we're bringing in from the faith-based organizations. We're going to start working with some churches, especially in the central Lincoln area. Part of the grant, you had to focus a little more on places where the need was greatest. And so there's a section of town where there's 8 elementary schools where the kids are more than 85% free reduced cost lunch, so very low income neighborhoods, so we have to focus a little bit more there.
Okay.
So you'll see some more, as those efforts roll out, some more detail on those.
Okay, very good. Well, we look forward to seeing how this grant progresses. Thank you very much for joining me today. When we come back, we'll look at a very important movement happening right here in the community.